Good evening, Mrs. Porter. I'm going to be heading home for the night, so I'm going to introduce you to Patty and Nancy here, who are going to be taking over your care, all right?
Okay.
So Patty here has been a nurse here for about 8 years, and then Nancy actually just recently graduated as a registered nurse, so she is actually precepting Nancy.
Did you just graduate from nursing?
Yes.
Well, congratulations.
Thank you.
So I'm going to actually be giving them bedside report, going over kind of the treatment we went over, all the tests and everything, and then update them on the plan of care. You are more than welcome to kind of add in any questions or any concerns while I'm giving them the bedside report, all right? Also, after report, we're going to be going into the next room and I'm going to give them same sort of a report. They'll come back within about an hour and they'll come and reassess you, okay?
Okay.
Thank you, Ms. Porter, for choosing Cadleck for your care. We look forward to working with you to ensure that you receive excellent care this evening.
So Mrs. Porter here is 60 years old. She was admitted today for a urinary tract infection onto our floor and will be receiving IV antibiotics. She presented today to the ED for complaints of fatigue, and then also the caregiver kind of noticed this cloudy, foul-smelling urine from her catheter bag. She does have a history of multiple sclerosis, so she is wheelchair bound and she does have an indwelling catheter. In the ER earlier today, they did change her Foley catheter and they collected a urine where they sent a culture from it. Her urine did show a lot of white blood cells and then nitrate positive with moderate amount of blood. All other labs were within normal range. The ED nurse did place an 18 gauge into her left AC, gave her a 500 ml normal saline bolus, and then started her initial dose of the IV antibiotics. Her vital signs upon admission were well within defined limits. Her blood pressure was 118/64, her heart rate was 88, her temperature was 97.9, her O2 was 98%, and then her respirations were 18. She is scheduled for her next dose of IV antibiotics at 2100. Any questions at all?
Yes, how has her urine output been since admission?
So I did empty out her urinary catheter bag when she first got here a few hours ago, and it was 150 mils of urine. Thank you so much, Mrs. Porter, for letting me take care of you today. I'll be back tomorrow, and they'll take excellent care of you.
You have a good evening and we'll see you tomorrow.
All right.
Hi, Mrs. Porter. Patty and I are back to complete your head-to-toe assessment. How are you feeling?
Where am I? What's going on? Who are you?
I'm Nancy, your nurse, and this is Patty, my preceptor. You're on the acute care floor at Cadleck. Miss Porter seems more confused than earlier. She's also tachypnic and her work of breathing is more labored. Her pulse feels fast and ready, and her skin feels cool and clammy.
Let's get a full set of vitals.
Her blood pressure has dropped to 98/56. Her heart rate's 120, and I also see a few PVCs on her cardiac rhythm, and her oxygen saturation's 91%.
How about her urinary output?
Okay. There's only 10 milliliters of urine. I wonder what's going on.
Okay, let's review our findings. Mrs. Porter has a change in her mental status from baseline. She's tachycardic and tachypnic. Her skin is cool and clammy. Her urine output is less than 30 mils an hour. What do you think we should do?
I'm concerned that Miss Porter might be septic.
And what should we do now?
Maybe we should call the doc and tell them our assessment findings and see what they'd like to do.
It would take time to page the doctor for orders, and that could delay care for Mrs. Porter. What can we do now to expedite her care?
I know. We should call a rat.
What number do you call?
4444.
Based on the information you guys have provided, her elevated Mu score, and my assessment of the patient, I would agree that she appears to be septic. Her most recent blood pressure was 88/52, so she's still hypotensive as well. She's quite sick, so we need to get the sepsis bundle initiated immediately. So we need to start with the lactate level, blood cultures, and fluids. She appears to be a fluid responder, and due to her hypotensive state, we will order the 30 milliliter per kilogram of crystalloid fluid. Most importantly, we need to get orders for and administer the appropriate antibiotic. We'll be taking Mrs. Porter to the ICU, and we will continue to monitor her status and care for her. Great job with the early recognition of sepsis and initiation of the RAT.